Good evening, viewers. There has been a major flood situation in the state of Assam, causing thousands of people to go missing and major havoc to the infrastructure.
The flood has affected in areas such as Ganeshguri, Dishpur, and Bola.
Now, over to Deekshant, our on-field reporter, who brings us visuals of the ground reality situation.
यस प्रतीक। हाँ, तो जैसे कि आप देख सकते हैं, आज मैं गणेशगिरी में आया हूँ। यहाँ पे काफ़ी बड़ी बाढ़ आई हुई है और एक हफ्ते से लगातार बारिश की वजह से यहाँ के सारे स्कूल, अस्पताल और सरकारी ऑफिस सारे बंद पड़े हुए हैं। और इसके बारे में और जानकारी देने के लिए आज हमारे साथ है एक पीड़ित। सर, आपका नाम क्या है?
रामलाल।
आपको कितनी क्षति हुई है अभी यहाँ पे?
हमारी बहुत क्षति हुई है। हमारी इस साल की फसल आज इस पूरे बाढ़ में चली गई है। हमारे परिवार में हमारी 7 साल की बिटिया है, वो काफ़ी दिनों से लापता थी। वो कल पुलिस ने मदद करके उनको ढूंढा। देखो, उनका टांग टूट गए, वो भी अस्पताल में है और अस्पताल डॉक्टर लाखों रुपए की ये फीस मांग रहे हैं। सर का ऑपरेशन कराना पड़ेगा, तो अभी उसी की चिंता है, पैसे भी नहीं है।
जी, तो आप अभी सरकार से क्या कहना चाहते हैं?
सरकार से अभी अब तो हम वही उम्मीद कर सकते हैं, थोड़ी सहायता करे हमारी छोटी सी बिटिया के लिए, हमारे लिए, हमारे पूरे परिवार के लिए, हमारे यहाँ पे बस्ती में सारे लोगों के लिए जो जिन लोगों ने सब कुछ खोया है, तो उन्हीं के लिए हम सहायता मांग रहे हैं सरकार से।
तो जैसे कि आप देख सकते हैं, एक किसान जिसने अपनी सारी फसल खोई है, ये कैसे अपनी बच्ची की उपचार कर सकती है। इनकी सरकार से यही उम्मीद है कि सरकार इनकी बात सुने और इनको मदद करे। मैं गणेशगुरी से वीडियो जर्नलिस्ट फीलिक्स के साथ मैं दीक्षांत, ग्राउंड रिपोर्ट, बैक टू स्टूडियो।
Yes, thank you, Deekshant, for the ground report. So, this is a major crisis happening in Assam, and what is the government going to come up with the health policies? Or
Actually, focusing on the healthcare, the government has introduced a lot of schemes providing healthcare to people without access and resources to do so. One of them is the Ayushman Bharat. It is a flagship scheme of the government of India, recommended under the National Health Policy of 2017. It was introduced in 2018 with two major components: health and wellness centers and the Pradhan Mantri Jan Arogya Yojana. In February 2019, the government of India announced the creation of 150,000 health and wellness centers, which were formerly known as primary centers or primary health centers. These now cover maternal and child health services and provide solutions to non-communicable diseases and diagnostic services. The second component under the Ayushman Bharat is the Pradhan Mantri Jan Arogya Yojana, which was introduced on September 23, 2018. Under this scheme, each family has a health cover of 5 lakhs per family in secondary and tertiary care. Thus, this scheme provides and covers 12 crore poor families across the nation.
I hope this piece of information will be valuable for our viewers, and I hope a lot of people will be getting benefits from the scheme.
Coming back with a quick ad break, we bring to you more on this scheme, that is the Ayushman Bharat, and how you can avail it too. Welcome back, viewers. Now we continue our segment on the Ayushman Bharat scheme, where we now focus on a more realistic perspective of the scheme and analyzing whether the victims it was supposed to benefit are actually availing the benefits for the same.
So, even though it's the world's largest health insurance scheme, I don't think the scheme has been implemented in a proper way in our country. There has been a lack of healthcare infrastructure which avail the scheme, or the services which has to be provided to the people, and there's a lack of professionals who can actually avail the services to the people.
Yeah. Moreover, the COVID-19 pandemic has exposed a structural failure with the government, and with the main being the failure of this healthcare scheme. Its commitment to leave no one behind has not proved to be effective. A recent report by the National Health Authority notes that an average weekly claims under the scheme has fallen by 51% during the COVID season. Moreover, wrongfully claims for cancer care and childcare deliveries have also been noted.
The government also faces a lot of difficulties in identifying and verifying the victims and providing the scheme. So there has been a lot of information asymmetry regarding between the government as well as the healthcare centers and among the people. So the beneficiaries are the actual beneficiary, which has to be benefited from the scheme, are not actually benefited from it.
Yeah. Our editors, when analyzing the registry of hospitals, found that only 3% of the private hospitals are registered under the scheme. During the first year, 1,200 cases of corruption were reported. The PMJ was supposed to provide full cover for the victims. However, it only covers about 30% of the medical expenses, leaving the rest 70% as a burden on the people who already do not have the resources.
And there has been a delay in the transfer of money from the government created government to the healthcare centers and to the public as well.
Yeah. In the state of Punjab, about 131 crores of medical bills has not been cleared until now. This shows us the massive loophole that exists in this scheme that needs to be filled in quickly to ensure that the victims and the people below the poverty line without the resources can actually benefit from the scheme. We now have a special interview with Mr. Abhijit Kumar, one of the top government officials involved in the planning of the Ayushman Bharat scheme. We can now look into his views on the ground reality of the situation and find measures to make this scheme benefitable for the people.
Good afternoon, viewers. Welcome back to It's My Show with Dikshant. I'm your host, and today we will be interviewing an eminent personality. This person has been instrumental in the development of the Ayushman Bharat scheme that is widely regarded as the largest health insurance scheme in the whole world. So let's talk more about this scheme and let's hear from him. Welcome to the show, Mr. Abhijit Kumar.
नमस्कार आप सभी का मेरा नमस्कार.
So sir, talking about the scheme, can you explain us how the scheme came into fruition? How did you guys make the scheme?
This scheme was first implemented to provide quality and affordable healthcare to every section of the society in India. And we have invested so much for government funds. It's one of the most largest healthcare funded scheme globally.
So as you mentioned, it's the largest healthcare scheme funded by a nation in the entire world. Can you explain more about the features of the scheme to our viewers watching the show?
Yeah, exactly. It provides 5 lakhs rupees 5 lakhs per family per year for secondary and tertiary care hospitalization, and also 12 crore poor and this vulnerable entitled families, like approximately 55 crore beneficiaries are eligible.
So as you can see, a lot of people can avail this scheme, and this has been thought out in a big way by the government. So as we talk more about this scheme, there have also been a lot of cases by government ministries and offices that state that a lot of the scheme has been availed by people that don't even exist in real world. Similarly, we have cases reported by Mint where they said that around more than 7 lakh people, beneficiaries, were associated with an invalid mobile number, specifically all 9999 numbers. So this really shows that these people don't even exist in the real world, and yet they are availing the scheme. This clearly shows corruption at some level, both the hospital level as well as the ministerial level. What do you have to say about this?
See, these kind of news, there are a lot of these news channels spreading this news, and if you ask me, I have never came across such atrocities and anything in this country. Like, what can I say about this? As if I can say, like, things happen. Like, India, it is a very big country. There are gonna be casualties and all. So that's it. I have to say, like.
Sir, but the Comptroller and Auditor General is the one who raised this issue, sir. It's an independent government body, and you guys are in the government. So this clearly shows some level of misconduct and corruption in the government. What do you have to say about this?
See, if you're talking about the government right now implemented this scheme. It has named a country, not a country, name a government in this country for the past 15 years who has invested so much of its public funds in this healthcare system. Now this scheme is one of the most largest this healthcare funded scheme globally. So these kind of cases just come and go, but our main motive is to provide affordable healthcare to every section of the society, so that like every, what do you call that, every society, every janata, the public janata can avail, every section can avail and provide.
Sir, around 1.1 crore rupees were paid to 403 dead patients by the hospital. This clearly shows that the hospitals was using the money for themselves through the scheme. What do you have to say about this?
See, such kind of, like I said, like these channels and all, they're gonna spread any information to put the current government into a black light, black shade. So what can I say? It's like, just ignore these hate comments.
Sir, your own son, Mr. Abhinay Kumar, also is a huge owner of a hospital chain. Sir, what do you have to say about this?
See, these kind of things come and go, and regarding my son, it is a completely different topic about abstaining from these all facts. And I request the reporter and the news media to stick on the topic and not beat around the bush.
So this is not beating around the bush, sir. This is a very serious issue, sir. So this clearly shows that you are there are priorities by the government officials themselves, and they have their own preferences, mostly for their family members, and especially for people like you whose children own hospitals. And it clearly shows that 1.1 crore rupees were paid to 403 dead patients that don't even exist in reality. So where did the money go, sir? This is all tax money. This is not your personal money.
I don't want to say anything. Cut the camera. Cut.
So Dikshant, how was the interview with Mr. Abhijit Kumar?
As you can see what happened in the interview, right? How it ended.
You were interrupted. You were forced to get shut down.
Exactly.
But you were making some very important points during that time. I think there was something about some beneficiaries scamming the government.
Yes.
Do you want to bring that to light here? You won't be interrupted here, don't worry.
Oh, definitely, Pratik. I am sure you guys don't interrupt. So, what I was bringing up to our minister was that around 4.5 crore rupees was disbursed to people, 650 people that were dead by the private hospitals. This means that 4.5 crores were actually taken from the government's government funded programs to these private hospitals. This is clearly a scandal being run by the medical industry.
And no one has any data of it.
No one has any data of it exactly as well.
Another point that Dikshant brought up during the interview was that 7,50,000 beneficiaries were registered to the same invalid phone number consisting just of nines. This shows the massive amount of loophole that exists in the system that the government still has not been able to fill in. Felix, do you have any policies that you want to suggest to the government that can better this situation?
So the government has started to use AI in order to check the frauds under the Ayushman Bharat scheme, and they have implemented biometric scans, the use of Aadhaar cards, and other government documents in order to provide the schemes to the right beneficiaries.
Exactly, this would help reduce the number of frauds in the scheme as well, which is a very good step by the government.
That's it for today, viewers. We are Felix, Dikshant, and Pratik with camera person Anmol signing off. Until next time.
Right, good.